Hello, everybody. I hope you can hear me. I'm just checking the sound. Thank you very much indeed. And Twee, perhaps you could just say some words. For some reason, my speaker's a bit weird. Can you?
Oh, good morning, everyone. I'll get started with the poll then. Let's see everyone's here today. It feels like all familiar faces. So I'll just go ahead and launch the poll directly. And hopefully we've got some people from East Asia and Pacific joining, because it's that time of day where they can. So again, where are you joining from, your age range, and how you're feeling today? And I'll keep that open until later. How are you doing with the sound, David?
I'm very, very good. How's me for doing a sound check, you know, like and when you go to a gig, sound check, 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 okay. And here we are at 1:30. Greetings to everybody. And to Chris Shipton, first of all, special hello, shout out to you. You know, and once again, a real vote of thanks for the quality of your presentations. A small group so far today. Welcome, just going by name, to Sarah, to Marianne, Anne Hendricks-Jenkins, Annie Feltham, Sanjukta, welcome. Nice to see you. Julian, thank you. Julian and I were talking earlier today about France in some detail. We will go into that during the briefing. Vicky, hello. Carlotta, thank you for joining. Holly, welcome. Louisa, welcome. Haruko, thank you for joining. You told us that you don't want to talk on the sessions, but we're really delighted that you're joining us regularly from right across the world. And really, it's fabulous and actually an honor to have you with us, given the challenges of coming at the time you're at. Claudia Batts, thank you for joining. Thank you also for connecting with me in between times. Joe, thank you for joining again. Really, really lovely that we're together. I think the fact that we've become a regular group is brilliant from my perspective, you know, because we're able to develop ideas together. And what I'm going to do is, as always, review the situation with the COVID around the place, and then invite comments from all of you on some of the issues raised. Yusuf Gottlieb, thank you for joining again and for the correspondence. Much, much appreciated. Gabriella, thank you. Nice to see you. John Atkinson's here. I'll bring him in quite a lot. He and Holly Wheeler were doing a very interesting training program for senior NHS personnel. And it's great that Mike Sanders, one of the very excellent directors of public health in the UK, is also with us. And Mike, I'm not sure how long you can stay, but it would be very, very good if once I've given my quick commentary, you could perhaps give us your perspective on what's happening in the UK. There's been a lot of changes since we were last together. So I just offer you the chance. And colleagues, if you want to come in, do make an expression, put something in the chat line, or if you're not on video, just open up your video and make it clear you're ready to speak, and I'll try to bring you in. Let me just tell you what I'm seeing. Hello, Magan Motepa. Nice to see you. So good of you to join. And we do invite people to comment. This is a very open and interactive briefing that we offer. And so if you would like to comment, just put a note in the chat, and particularly telling us what you like to talk about. Then it makes managing very, very, very good. And I will try to bring people in. I've actually got quite a lot I want to say this morning. So I'll be condensed, but I'm going to be very focused. Quite simply, any of you in Europe will have realized during the last week that this virus is once again advancing in a ferocious way in different parts of Europe. We were expecting it because the movement restrictions during the spring and summer European months of this year did lead to a reduction in numbers, and that was expected. But we were also anticipating that as the movements restarted, so the numbers would go up again. It's a very simple thing, this virus. It just has one purpose in life, which is to multiply. And of course, as soon as people move around after they've been not moving, you do get more people with the disease. I mean, it's starting with lots of younger people getting ill because they are moving around a lot, and the older people are being a little bit cautious. But frankly, if you look at the numbers, and I've particularly been studying France, this disease is really increasing very, very fast. Take the city of Marseille. Health Minister Olivier Véran was announcing the day before yesterday that as far as France is concerned, Marseille and Guadeloupe are super red territories. And so a quite major movement, local movement restriction has been introduced in Marseille, partly to try to protect the health services, but also to protect the population. The health services in Marseille, according to the information we've received, are filling up rapidly. And there's an awareness in the part of the French government that there's very little room for maneuver, that if intensive care beds fill up with people with COVID, including at the moment with children, that actually really does mean that there's not a huge amount of latitude. You can put up these temporary hospitals, but France doesn't want to do that. The French government is also really trying not to impose nationwide movement restrictions, and instead, where there are pockets of disease surging, they want to introduce local movement restrictions. Now, what I've learned with COVID, and I learned it during the early rises in cases in March, April, May this year, is if it's happening in one place, it's probably happening in a lot of other places at the same time. So yesterday, I had the good fortune of meeting with Oliver Morgan, who leads the epidemiology teams at WHO. He and I worked together during Ebola in West Africa. He was at that time working for US CDC in Freetown. What's really interesting to hear from Oliver is that although they don't have full information, because not everybody who's got COVID is tested, so they're dealing with partial data, but they're saying, yeah, it's picking up all over. Now that that period of lockdowns during the early months of this year is well and truly being decreased in many places because of understandable economic reasons, we are seeing increases in the numbers of people with COVID in all age groups in the United States, in Canada, all over Europe, in Ireland, particularly in Donegal, in the UK, particularly in some northern cities, but it's coming up in London as well. In France, I've mentioned, in Spain, particularly in Madrid, where government is inviting military help with dealing with the situation. We've got increases in Israel. Yusuf has been talking about it. We see that, and really big concern to the government. But increases in Indonesia, really numbers going up rapidly. And this is a big country. Continued increases in India, Nepal, Bangladesh and Pakistan. Increases in Russia. Increases in Mexico and other parts of Latin America, increases in the United Arab Emirates. So my point I want to get across to everybody is this virus hasn't stopped, it hasn't changed, and it is on its journey in many, many parts of the world. We need to recognize also that everywhere where the numbers of people with disease are increasing, we're also seeing hospitals, ICUs in particular, filling up. There's a report in the American Journal of Epidemiology studying 230,000 infections in healthcare workers around the world using a meta-analysis, showing us that the vast majority of healthcare workers are infected are nurses, and they're not nurses working in intensive care units. They're working in all sorts of locations in the health system. Physicians have a lower infection rate. Other healthcare workers also have quite a high infection rate. It's absolutely clear that health workers in the earlier months of this year were not able to get all the PPE that they needed and were getting high viral loads. We have, I think, a figure, I've said it before, of somewhere in the region of 5,000 health workers have died already as a result of COVID. And these are people who were mostly infected through their work. So the challenge of making sure that health workers continue to be protected is huge. I think most of you know there's another issue for health personnel, and that is that an awful lot of health workers around the world worked incredibly hard during the period February through till July, August, and now they're going to be asked to work incredibly hard again. Public health people all over the world have been working hard right through, and there's not a reserve cadre of public health people. We know that because when you're trying to pull public health people in to move them to deal with outbreaks in different parts of the world, there's a lovely mechanism called the Global Outbreak Alert and Response Network that's been set up. It's really good. You then find that when you've got something like this, a major health crisis, there is not a world reserve. We just don't have sort of spare people, particularly people with experience of dealing with outbreaks. And the WHO's recognizing that it's going to be quite tough on all health professionals, those who provide care and those who work particularly in public health in the coming months. They're going to have to make really difficult decisions. As again, I said, not a reserve. I'm quite interested in any of you who want to talk about how we can encourage those who work in the health sector to be able to pace themselves and to have their work responsibilities paced over the next 6 to 12 months. I'd love to talk with you about it because I think it needs actually quite acute attention. I think that one additional factor that you will all have seen that my colleague Julian Delamontax was talking about, particularly this morning, from the perspective of his commune where he is one of the elected officials, is the following. There's a growing number of actors, particularly those who've got small and medium enterprises like restaurants or small food businesses, or those who've got who are active in the hospitality sector, in tourism and the like. There's a real sense that they've had enough. This is not so much the really angry conspiracy people who've had enough, who are quite noisy about wearing masks and so on, but this is a broader group of people whose livelihoods have already taken a big hit, who are likely to take a further hit in the coming months, and who are worried that quite generous government support schemes that have been implemented all over the world can't go on supporting them. In my analysis of looking at the economics, I'm reading of support packages all over the world, from Mexico through to Malaysia, but I'm also reading a sense that these have limited time duration. So it's quite tricky for governments, because on the one hand, they are going to have to ask people to continue changing their behavior. They probably will want to ask people to work from home where it's possible. They will probably continue to ask those in the hospitality sector to close early in the evening to try to stop super spreader events in pubs and in hotels and the like. But at the same time, this is directly leading to tens, perhaps hundreds of millions of people in really major economic difficulty. It doesn't always turn into a political debate. It sometimes does, of course, as in the US. But the reality is that for the public health community, and then for decision makers, prime ministers and the rest, actually finding a way to manage the public messaging is more and more difficult. Hidden in this is the inequity situation. There's another meta-analysis that I read this morning that's come from the US, showing that, if we didn't know it already, minority communities, poorer people, are really still being harder hit than everybody else. None of this is new. We've been talking about this in our briefings, actually quite regularly. Now, I think we have agreed amongst ourselves that it does not have to be the economy versus public health. And that constant presentation of the policy choices as either or is unhelpful. In my media work yesterday with Sky Television in the UK, and I've done some work with CNN recently and others, I find myself constantly trying to say to presenters, it isn't just an either or choice. It's a both and choice. And then I'm now really quoting Tedros, who last week said, on the precautions that people can take, we've got to go on talking about doing it all. Doing it all, it's quite simple because you can count it on the fingers of one hand. And we start always with physical distancing. We know that some people will say, well, physical distancing isn't enough. But if you look around the world, the majority of transmission is droplets, and droplets is 2 meters. So we have to keep that high on the list. Secondly, face protection. I mean, there are two arguments that I think we have to keep bringing on about face protection. One is that it actually does reduce risk, and we can't put an actual quantity on it because each situation is a bit different from the others, and it's quite hard to do controlled trials. But in Germany, looking at communities where you had different masking rules because of different administrations, it is abundantly clear that there was a reduction in transmission. And then there are some very delicate studies that have been done of individual restaurants where some people wore masks and some people didn't. And there's been a follow-up. So masking does help. And I think universal masking is a really important policy option that ought to be adopted. And that includes outdoors. It's not just indoors. Because if you're universal, you might as well do it everywhere. And it means really doing it and doing it properly. I'm aware that there's going to be constant attacks on this, but if we could get physical distancing and masking much more widely practiced, I think it would help. And then the third part is hygiene. And there are three sub-strands to hygiene: hand hygiene, cough etiquette, and surface hygiene, because we are worried that in certain places, surfaces have been important. And then the fourth thing is isolating when you're sick. I think isolating before you get your test is absolutely critical. And I know from even around here, this is not easy to do, but if you're not feeling well, you should isolate. The tougher one is when do you isolate if you're a contact? Because there is some need for precision on how long you've been in contact with somebody, how close you've been to them, when the contact started in relation to your own illness. But I think we can develop much more understanding among people about what are the rules or practices for isolation. And then the next thing is protecting those who are vulnerable. So if I just revise it for you: physical distancing, face protection, hygiene in all its dimensions, self-isolation as well as isolation of contact, and protecting those who are vulnerable, who've got pre-existing cardiovascular disease or diabetes, or who are older, or who perhaps have got limited respiratory capacity. I have got a son, my son Tom, I think some of you know him. We talk a lot about the reality that he's not got the most brilliant spare lung capacity. And I said to him, please do what you can to avoid getting this thing. And so trying to keep those all-in precautions in mind is really important. I want to continue to encourage campaigns on Do It All. I talk to businesses about this. I talk to local authorities. I talk to campaign groups. And I think that it's picking up slowly, and some of you have been taking it on. Then the second part of what needs to be done is the basic public health services to interrupt transmission of the virus. Absolutely critical. And we see where it's done, it works. I mean, it doesn't work immediately. It's not something you just introduce the transmission interruption regimes and suddenly everything stops. But it's how you break clusters up and you stop them from forming. And then lastly, combining the two, the do-it-all precautions, together with the transmission interruption capacity, bringing them together at local level. Now that could mean inside a big factory. It could mean in a relationship between a factory and the local authorities. It could mean bringing in religious groups and involving them as well. And listening to some of the people in Leeds, UK, Greater Manchester, UK, in different parts of Victoria in Australia, in particular, and in Singapore, in Germany, in Canada, just listening to decision makers. They're all saying, if we want this to work, we have the do-it-all activities that people need to do, the really widespread public health capacity that the authorities need to do in order to help people to get their things right. And then we integrate it all at the local level so that at the end of the day, people do the right thing at the right time because they choose to do so rather than because they're instructed to do so. And trust has to be at the heart of this. We come across time and time again people who just get it and who are doing brilliantly. Yesterday, Catherine Deland and I had the most amazing time with a guy called Steve Kennedy, who is running one of the largest meat production plants in Australia, in Victoria. And he described the way in which they have managed to really limit the extent of their COVID cases in their meat plant. It's the third story of a meat plant doing it really well that we've heard. We've had one from the US and one from the UK. And when you go into what they're doing, it's really fabulous. I'll just give you just a few headlines from what they've done. First of all, they worked with their employees right from the beginning to help them to understand that they would not face financial penalties if they were off work. And so that meant that it was possible then for the employees to be partners with management in thinking through what was involved, because they weren't feeling that management was somehow penalizing them for staying away, especially when they wanted to work. But management was encouraging them to stay away if they were feeling ill themselves or if they'd been in contact with somebody who'd been ill. Secondly, they involved the employees in the design of structural changes in the plant to reduce risk of exposure, to improve the space available to employees, and to really try to get things so that there were fewer and fewer opportunities for transmission. They put their employees into pods, groups who stuck together, ate together, changed together, worked together. Employees didn't really like that so much, but they understood that this was a device to try to limit what might happen if a cluster built up. They had 13,000 employees in the plant, and they wanted to try to make sure that if a cluster started, it could be contained because the workers were working together in what they called a pod, a bit like the British bubble system. And then fourthly, they worked very closely with the local authorities because the workers obviously were at risk inside the plant, which is one of these 4 degrees plants, and the virus just seems to stick around more at 4 degrees than it does at 14 or 24 degrees. And so they were able to work with local authorities and establish a protocol. So that what they wanted to try to avoid was that the whole plant would be shut down if there were 1 or 2 COVID cases reported. The same as I think happening in a lot of universities around the world right now. Can they work with local authorities to establish protocols so they don't have to close everything when there are just a few cases? What was really lovely about listening to the people from Castlemaine Foods was that they were proud of what they were doing, but they didn't think there was anything special about working with the employees to find ways to deal with the COVID. And they thought this was just good practice. And I think that this is really the way we would like to try to share this. It's good practice to have local integration and working together at local level. It's good practice to engage with your employees and of course get the union working with you when you're dealing with it in a factory. It's good practice to work very carefully with the employees in residential care homes and so on. One of the things that's come out from our discussions with the big meat factories as well as with the residential care home owners is that it's much easier to do a constant relationship with your employees if you reduce the proportion of your employees who are on contract labor. You know, some of these meat and other food factories, as well as having their own staff, their regular employees, they also bring in groups of employees who are provided by a contractor whose job it is to supply gangs of workers to fill the gaps, because quite often there's a shortage of labor. This is not exactly the most fun work for people to do. And when there's a shortage and the assembly lines can't work, it's a real problem for the production system. So they have these labor contractors who will bring in a busload of people and offer them for a period of time. But the companies, whether they are running factories or residential care or whatever, are telling us that it's really hard to do this employee management joint effort if you're dealing with contract labor that is coming in and out more casually, and not sticking around. So it's quite a lot harder to establish a relationship with them. I'm sure many of you will have heard that that's been an issue also in residential care facilities. So it's quite interesting that getting on top of COVID is forcing employers to look again at their employment practices. And talking again, last point, with the food people in Australia, they showed us that the process of trying to deal with COVID and change the way in which the factories worked and so on did mean that they had to take quite a big financial hit. They were not able to run with the production at the same rate. They'd had to reduce the production rate of some of their operations. This meant that they were producing less. They lost market share because other food companies in the country, in Australia, were less affected by restrictions. And I said to him at the end, you know, how did the company cope with this? And he said, well, sometimes in the kind of business we do, you just have to accept that you are going to temporarily lose market share because you are trying to deal with a problem. He said, remember, we have food safety scares quite a lot in food, and periodically we have to have recalls, and that does mean we'll lose market share. But he said, the one thing that we've learned about COVID, it's not going away. And so we've got to build into our working practices ways that are going to be sustainable for the future. And we want people to come and work for us. We've got to be an attractive employer. And we won't be an attractive employer if we start making workers feel that they come here and they in turn get penalized for something that's they don't perceive as their fault, which is of course true. So and the reason why I tell you this is that, yeah, this is super bad news, this COVID. But what Catherine and I felt yesterday after talking to Steve Kennedy was he gets it. And when you find people in city councils, like we've been talking with Leeds and Leicester and Manchester, people get it. you really feel great, and they get it on trust, they get it on working with the employees, they get it on working with local authorities, they get it on creating COVID-ready situations. And the fact that there is a growing number of people who get it is really, really exciting. And that brings me to sort of the end of today's thinking. I've been writing a lot about what I call the middle ground. I wrote a reflection that we published yesterday on our website, and we got quoted a bit in the UK press. It's not simply going back into lockdowns. You know, that is not a viable way of dealing with this virus. It never was. We used to say in WHO earlier this year, lockdowns buy you time. Use that time to build up your testing capacity. Doesn't mean you're going to have universal testing, but at least consider where you're going to concentrate your testing. Keep enough testing spare so you can deal with the spikes when they build up. Use the lockdowns properly, but don't use lockdown as your basic control measures. All the time, think about involving all people at local level in an integrated way and trusting people so that they're at the center of it, because that's actually the only way to deal with this. Try not to be going on, off, regulation, off regulation. One hand telling people to go to pubs and restaurants more to save the SMEs there. On the other hand, telling people that there's a curfew at 10 o'clock. I noticed that Belgium, I mean, I know the Deputy Prime Minister of Belgium a bit, and I was seeing him quoted, have been doing everything they can from the government to try to stop on, off. Try to maintain the constant narrative, making certain that people do understand the basics of this and keep repeating it, repeating it, and repeating it. And last of all, do look for the long term. You know, it is 6 months to 1 year, but instead of presenting the long term as a miserable prospect, presented as the really exciting possibility that humanity will be able to get ahead of this virus. I mean, just look at what's happening in South Korea. Look at what's happening, in fact, in many East Asian countries, Vietnam, Thailand, and the rest. They are managing. So with that, I go straight to Mike Sanders. Mike is really a very key figure in public health in Leicestershire. He has been watching and feeling and experiencing this all. He was last with us a few weeks ago. Mike, what's happened in the interval? Would you like to give us an update from your perspective and tell me, am I right or wrong? Over to you.
Yeah, glad to, David. I was going to say, you're absolutely right. And some of me would say, you know, I've not been on one of these for about 3 weeks, and that's because it's been an incredibly difficult 3 weeks with a really rapid rise in cases, and everything that you said around international increases in rates and the drivers behind that, and some of the both personal sort of behavior drivers and then the sectoral drivers is absolutely what I've been experiencing locally within my patch. So at the risk of boring people, because you know all this, it is literally 3 weeks to the day since our numbers started going up. So until September the 4th, you know, I was in a reasonably good place. But then I looked at the daily figures one day and they just seemed to shoot up. And we can all speculate as to why they went up on September the 4th and 5th. You know, for those from the UK, you'll know there was the last of the public holidays in England on August the 31st. It was the last day of the Eat Out to Help Out scheme that you're just referring to, those, you know, the economy incentives to get people eating out, coupled with a return from holiday, a return to school, and the drive to get people back into the office. I mean, I just think we injected too many sort of interactions in one go into the environment, and then got the unfortunate sort of, you know, the inevitable side effect that we're going to get. I've been using a lot in my work, I guess, fire analogies, and I just think in that one that we just put too much tinder around the fire, and you get to a stage where the fire takes hold, and before you know it, it's out of control. Incredibly clustered. So I've got areas of my patch that surround Leicester City and areas which are more rural. The best I've managed are the more rural ones. I've seen a doubling of rates within the last month. The ones that are closer to the urban area, we're looking at increases around 4 or 5 times. So again, I just think the interaction of travel to work areas, school catchment areas, nighttime economy areas, you know, it's common sense. They don't stop at administrative boundaries. There are kind of natural geographies and natural communities that people live in, and those are the ones where it really takes hold. Having said that, and coming back to your positive bit about taking action, you know, it's not impossible. In my worst affected areas, we've managed to halve rates within 10 days flat from a peak of about 3 weeks ago. My other areas, I would like to think, at least temporarily, we've put a stop to this. So I'm not necessarily seeing the sort of dread exponential growth that Patrick Vallance and Chris Whitty, as the Chief Medical Officer and the Chief Scientific Officer for England, gave on Monday. So it is not impossible to take action to do this. And some of that for me, though, coming on to your point about stop-start, is you know, some of my media work is really going back to first basics. So we've stood up much more of a behavioural change campaign, trying to use media just to appeal to people's best interests. It's down to us, you know, never mind the rules and regulations. And your point about stressing some of the key things around space is absolutely right. I know the UK government or the English government has put hands, face, space in as the key sort of strap line. Are guilty of usurping that sometimes on the radio and saying, no, the real message is space, 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 face, face, space, face. Oh, and a bit of hands at the end if you really want to. And there is something about trying to get that spacing in. Your comment about universal masking, really interesting. We took a decision to, we had some concerns around parental behaviour at the school gate because we actually thought the regulated teaching environment was fairly safe, but the school gate was where we saw social distancing breaking down. So we're formally encouraging parents to wear masks on the way to school when they pick up their children on the way back. It doesn't necessarily go with the evidence, but kind of universally it's been really well accepted by parents, because I think people buy more into the precautionary principle of, well, if it feels like a good thing to do and it helps stop the spread, do it, than they are getting into a debate about rules and regs. Because otherwise, every time a rule and regulation comes out, I feel the debate is around, well, what does that mean? What about this exemption? How do I find a loophole around the law? Instead of actually trying to come back to the basics of, what is it that we're trying to do by these rules and regulations? And again, I'm probably guilty of nicking your phrase around, you know, the virus is fairly simple. And I've ended up saying on the radio, I don't think the virus really cares if it's 6 people or 15 or 30. The important thing is it's just trying to find a way to spread. So I've been trying to get round inevitable message fatigue, not just the anti-mask brigade, but just people who are tired of this, by really trying to go back to first base around human behaviours. And lastly, to finish off with, trying to engage around some fairly basic public health risk communication, just to try and combat those people who say, well, it's a 1% fatality rate, I'll take my chances. Literally, I've been on the radio going, yes, but if I offered you a bag of Maltesers and in those Maltesers was one that would kill you, you would say no. And just trying to get simple stuff through to people around what fatality rates means is kind of quite nice, because actually it's back to basic public health principles of teaching risk to people. And it just offers up a slightly different way, and hopefully a more human way of engaging, other than going on about rules and regulations. So as you say, it's been a pretty desperate 3 weeks, I must admit, but there are glimmers of hope in there, and there are people who really want to sort of be champions for this and do the right thing. I'll pause there.
Mike, it's lovely to hear you and to see you and to understand the way in which you're approaching this, which is just so cool. Can I just ask you, how dependent are you on the political leaders, I mean, and your own chief executive in your council? Do you feel that they are giving you the space you need to do this work, so you can do your radio work, your interactions with the schools, your interactions with the factories, or have you just been doing this on your own without that kind of support? Oh, I've lost you for a second.
I'll just take myself off mute. The first thing to say is actually the best thing they can do, and which they do, is to leave me alone, to trust me to get on with the job. So sometimes the best support is to not get, not to be bothering you every day. From my council's perspective, yeah, chief executive and leader absolutely support what I'm doing. They give me the space to take action, to take the action that we need to, without wishing to get into sort of, the sort of the structures of English local government, which would be very boring for people. It is interesting, you do get more pushback from local members, so not the executive, at the top, but actually some of the more local patch members. Inevitably, when you say we need to take action in this particular area, do the pushback, which is, well, why us? Where's the data? And when you show them the data, they use it for their own ends. So there is an interesting difference between the higher members, the inner members of the cabinet within local government, and those patch members who, I guess, inevitably have got the pressure they feel from their own constituents as to what's going on in the local area and why are they being picked on. And again, some of the messaging at the moment is that this is shades of grey and shades of black. Nowhere is in a good place. So please stop arguing about why are we having these restrictions imposed or these leaflets sent to our particular area, but others haven't. I mean, really, that's about rationing of resource. But it's that's a more complicated, complicated dialogue with members, really.
But you do use dialogue. I'm really interested in the importance of dialogue, often using the data. And then this lovely one of a bag of Maltesers. If you don't know, Malteser is a particular kind of beautiful.
Yes, other brands are available.
It comes in nice big bags. And Mike's point that if you knew that one of the 100 in the bag might kill you, you do not buy that bag. So interesting. Communication risk is a lovely challenge, and I'm glad to hear, Mike, what you're doing. Thank you for being with us, Mike, on behalf of us all. And I think all of us wish you all the best as you kind of take forward this vital work. And it's great to hear this lovely thing that you've managed to get the numbers down in some of your fastest growing areas in the last 10 days. I mean, stopping the exponential, beautiful. That was Mike Sands, Director of Public Health of Leicestershire in the UK. We're going to Sarah, we'll stay in the UK just for a bit, then we'll go global. I'd like to go to, if I might, to Sarah Phillips. Sarah, I'd like you to talk a little bit about your local situation. Off you go.
Hi, thank you. Can you hear me? Yeah.
Yes.
Thanks. We've got a small community just outside Nottingham, Rushcliffe, and we've got quite a green area. It's a village that's quite dynamic and does quite artsy and that kind of thing. And normally it takes up its own authority, but I've just noticed this sort of dependence and, oh, well, we'll be told what to do. And it's quite strange. And I'm wondering how that links to the local governments and what we're hearing that's happening in Leicestershire. And I'm thinking, right, who's our person in Nottingham or Rushcliffe? Or how does I'm healthcare, so I don't know how the infrastructure works in local councils, and I'm aware I've heard some things in here, but I feel it's that dependence culture that we're seeing around a lot, but particularly here, it's, well, what can we do? And we had one incident of a child, a friend of my family's, who in Rushcliffe School, who was tested positive. And none of the rest of quite a big family, none of the rest of the family have tested positive. There was a little WhatsApp group that gathered round, and there was this sense of community. And I thought, blimey, and we're all talking. If we could get that community link and the things that I've learned here and other people are, we could really get that virus isolated. It was contained within that family. It didn't spread to the rest of the family. We could contain it in this area, but it just feels like there's no sense of leadership to engage with that and to kind of make people feel they can do that.
So, I mean, I can't obviously talk specifically because I don't know about a local government in Rushcliffe, but I'm going to I do want to say to Sarah and to anybody else, it is going to be local action amongst people in a community, perhaps working with the local health people, general practitioners and others, that will be the route through which early chains and clusters can be managed. Because especially if you've got just a very small number of cases, that's when you need to do everything possible to help people to isolate, to make them feel good about isolating the individuals, isolating the household, even going beyond, because it will only be through local neighborhood action that this can be done. If one waits for somebody to tell us what to do, you're waiting 3, 4, 5 days perhaps, and an awful lot of mischief can happen in those few days. So just remember, it is about universal precautions, and at the same time, it's about isolating individuals and their contacts for the period of time necessary for the virus to disappear. That is the only way to deal with this. There is no magic solution. There's no drug. There's no other technique that we can use. It is just the old-fashioned technique of isolating people with the disease till the disease has run its course, or of course getting them to hospital if they need treatment, and trying to make sure they don't pass the virus on to anyone else. I wish it was fancier than that, but that's all it is, Sarah. And it sounds like what you're doing with the WhatsApp group, with people working around the household, supporting them, sounds really good. I mean, and certainly if you said to me, should we be doing any more? I don't think I would add anything more. I would just say that has to be the basic principle. John, do you want to add anything on how you would react if it was in your local area? You're in Rugby, you're a bit away from Nottingham, but what advice would you give to Sarah?
Well, Rugby's a bit different to Rushcliffe. I mean, Rugby's a working town. It's got about 120,000 people around it. So that sense of community is not the same. But I think I would be saying to Sarah, you don't really have to wait for the local authority to do all these things. The people who organise the artsy sort of things are probably the heartbeat of the community, and they're the networks that exist there. So whatever the networks are in your place, use them to positive effect. And it's not about sort of preaching through them. It's about, I think, this sense of how do we look after each other, because we feel a sense of community. And even a bigger place like Rugby, I noticed that they tweet what the numbers are as a council all the time, and saying, look, it's going up, let's look after each other. And I think it's an advantage to be very small and very local in that respect. I think what I was hearing from Mike is that some places, if you really focus on that particular place and get the right people connected to each other and talking to each other and getting the messages through, you can make a real and significant difference. So sometimes we sort of give up all our authority to somebody else, some higher authority, and my sense is you just have to get on with it, really, and use the people you know.
Building on that, Sarah, Mike Sanders was saying he has been really busy over the last 3 weeks. Every single person in public health that I've spoken to all over Europe is just completely overwhelmed, because it's all coming up at the same time all over the continent, and in fact all over the world. So in some places, the authorities are just so stretched that they're not responding to calls. And you all know that getting tests anywhere now is pretty difficult, except according to my colleagues in Switzerland, but just about everywhere else, it's so hard. So we're kind of going to have to improvise and do it using our own resources everywhere in the world in the coming few weeks. I'm just saying to Sarah, please stay connected. Twee and I know how to communicate with you. I'd like to follow up with a phone call at some point, and let's try to fix that up, if you don't mind. Is that all right? I can see you. Yeah. Okay, we're going to follow up with you. I'm going to shift a bit now. I'd like Joe Nichols to come in. Joe, I see you. You've got just J-O on your thing, and you are. I can't see you physically, but I think we can hear you if you unmute. I'd like you to, this is a really important point that you have, a couple of important points that you raised. So if you can hear me, Joe Nichols in Nairobi, here you are. Nice to see you.
Yeah, sorry.
All is well. In you come, 2 points, yeah.
Yeah, and apologies, the camera might wiggle around a bit. It's a handheld device. Yeah, the question really was about the universal masking. And I mean, in Kenya, there is a requirement to wear masking, but if you drive around in a car, you're certainly expected to wear a mask if you're with anybody apart from your close family. But it's also seen as a reason for the police to perhaps ask for an extra soda or a cup of tea or something if people are breaking the rules, rather than as a means to enforce it. But also most places people are not wearing masks. I mean, markets, they're not. And I think there's a decision that people make. It's about how far away from other people they are. And so I suppose what I was wondering was, when you say universal, obviously in a busy place, it makes complete sense. But if somebody is in the park or on a walk and they think they can maintain social distance, should we still be encouraging people to wear masks? And then again, a similar question at home, especially as schools start to reopen. My sister has 3 kids. They're all in different school years. Each school year has 150 children. They're in their school year bubble, but that's immediately 450 kids plus all of those children's families. So what should we be thinking about at home in terms of keeping people safe with regards to masking as well? And where's that balance between striking a guidance that people understand and putting something in place that people see as overly restrictive? Thank you.
Well, I mean, Joe, thank you. In a way, you've addressed it yourself, because we want to shift from a situation where everything is done through rules to where everything does depend on people working at risk for themselves. By introducing the concept of universal masking, what I'm trying to suggest is the default position should be wear a mask. But then if you're in a bubble, a household bubble, or a social bubble, or a work bubble, then you might decide not to wear a mask. But there are obligations that come from being in a bubble. I say this because in my own family, I was talking about my son earlier, he needs people who look after him, who have to come up close. So the obligation in his bubble is that people who are in the bubble are also extremely careful about what they do as they go about their social lives and professional lives. It is no good if they, when they are outside the bubble, are in close contact with people who they don't know, potentially picking up the virus and then bringing it into the bubble. That's the whole point about these bubbles, is trying to make sure that everybody within the bubble is practicing the same core disciplines in relation to the universal precautions as each other. Because if one person breaks the culture of the bubble and goes to a nightclub or something and does no protection, then there is an added risk. I do think these very large bubbles with, say, large school classes and so on are super risky, because all the research seems to suggest that bubbles only work if there are about 10 or so in them, and perhaps less. When you get up to big numbers, trying to maintain the collective discipline of the bubble gets so much harder. So that's kind of the basic rule that I would try to use. And it does get difficult if at home, if you've got a child going to school and you don't know how well the bubble is being maintained at school, then the child comes back home and may be bringing the virus. And if you've got older people at home, perhaps who've got diabetes, then you've got a super high risk situation. And I don't have a universal rule for it, but I think if you are not confident that the school bubble or the work bubble is working, then there does need to be very careful attention to physical distancing and masking at home. Back to the point that I started with, Joe, I would like the use of the do-it-all precautions to be the default position, what people normally do, and that the non-wearing of a mask is an exception. That's, I think, what I'm trying to get at. I'm sure, Joe, I haven't necessarily given you an answer, but I wanted to share with you my approach. And if others want to come in on this, please do chip in quickly. Joe also is worried about whether or not it is possible to get good public health messaging when governments are not strong. I think it gets really difficult. I think if the government is not giving a clear message on what to do, it's really hard for people at local level to come in, because if a local person is saying something and the government is saying something different, inevitably people will wonder what is going on. And Joe, do come back. Actually, the best thing to do would be if we could exchange by text on some of these issues, because they're quite nuanced, and I would like to hear more about the kind of challenges that you're facing in relation to school in Nairobi. I'd like to go to Vicky Doyle. Vicky, the reason why I wanted to bring Vicky in now is that she's been working with Nazim on trying to use music and lyrics to encourage a sense of trust and respect. And Nazim has taken advantage of the focus on these issues in the United Nations General Assembly. It has been quite extraordinary how much attention there's been. And Nazim was performing in the margins of at least one UN General Assembly event. What's the reaction been like, Vicky, please?
Well, actually, he's performing next week, so I'll put the link in a minute so you don't miss out. It's PMNCH, and it's a call for action to our leaders to be more accountable and for citizens to be more responsible. So he's written a new song, Time for Change, and there's some amazing animation which has been done set to COVID ready as well. So it's going to be, I think, quite an exciting half-day session. 29th of September, so I'll paste the details in there. But no, I think just in terms of his music, and yeah, I think this is the really important thing, is it's about trying to give hope as well, and to bring communities together. So I think a lot of what we've been discussing today is so relevant, and using music as that medium to do it. So the only challenge that we've had really, I think at a global level, it's been easier. It's working at within Gambia, it's been more difficult, and I think I discussed that a bit in the LinkedIn group, because I think governments are still a bit reticent to work with musicians and artists because they often see them as activists who may be speaking against them, and so that's the challenge we're having at the moment, is more working in country, working with government. So if anyone has any ideas, hints on what we can do there, we'd greatly appreciate it as well. And I'll put the link into the accountability breakfast, which I would really recommend people to attend if they can.
Vicky, have you managed through Nazim to get any connection between musicians who are working through their art to increase people thinking about the issues and trust building?
Well, we've actually been talking with a new research project actually at the School of Tropical Medicine, who are looking at how to do that actually.
Liverpool, yeah,
at the Liverpool School of Tropical Medicine. So we're actually in discussion with a research program there to look at how we can try and get musicians across different countries to be working together on the same messaging. So that's going to be quite exciting.
Thank you. I'd like to go to Mike Sanders before we close. I hadn't noticed you were still here. Mike, Jo Nichols is in Nairobi. She's working with the UN, looking out into Somalia as well as across Kenya. And you heard our exchange probably. I wasn't sure whether you were on masking, particularly in communities that weren't quite sure what to do, and also with the challenge of very large school bubbles. What do you do then about kids coming home, and how do you try to keep the home free of the virus? Do you have any thoughts on you must be dealing with questions about school. Secondly, you might have heard Sarah Phillips talking about the challenge of connecting with authorities just outside Nottingham, dealing how they can work with a small number of cases in a couple of households. So just like any comments.
Yeah, well, Sarah, I'll pick up separately, mainly because my opposite number for Nottinghamshire, Jonathan, lives about 2 miles away from me. So if I'd have thought, I'd given him a shout and we could have done this together, which would have been quite interesting. But there is, I mean, I won't go into the detail because there's quite a lot of almost differences in the way local government works in Nottingham, Nottinghamshire and Leicester and Leicestershire.
Okay.
The masking thing, I mean, I did put a comment in the sidebar because actually there is something for me in terms of universal masking, which is trying to impress upon those people who are too scared to live a normal life that you can go too far with communicating risk. And some of me is about, you know, actually if you're in situations where you're up a hill on top of a mountain enjoying the view, just enjoy it because the risk is so long, you know, so low, you should not be scared to live a normal life. So there is always a flip side. In terms of the bubble bit, again, I think that's interesting, and it comes down to trying to get people to do the kind of social distancing all the way through the journey of the day. So again, I talked about school gate, but the play dates after school, the kind of cup of coffee between parents in the kitchen after school, all those kind of issues are ones where we're seeing social distancing break down. So in terms of masking, do you want, do you just say basically you wear a mask every day? Clearly your example in terms of a vulnerable population is really, really critical. But there is just something really about coming back to the core messages of keep your distance. And, again, I mix my analogies all over the place, but a boxing style, never drop your guard, is one of the other ones that we just need to try and get across to people.
There you have it, ladies and gentlemen. Mike Sanders is thinking up analogies all the time. That latest one, a boxing star never drops his or her guard, is super important. We need to keep these analogies because all the time it's about helping people to develop their own way of dealing with this virus and also to have their own logic. But if that logic is a logic that is going to reduce risk, goodness me, it's powerful. A super shout out to Mike Sanders. Thank you very much indeed for joining us again. Just to tell you about a few people who've sent in comments before we close. Anne Hendricks is always giving us absolutely fabulous suggestions, and she's working in Benin and she shared a resource on the chat. I'm grateful to you, Anne, and always asking you to keep flowing in the examples of communities working together. And particularly when there isn't necessarily an authority offering the precise direction. We are really now in a situation where movements at local level are going to be key for working through the risks. Just remember, it's going to be at least a year and probably a lot longer while this thing goes on. And it's going to be global simultaneously. And the world's public health community is not sufficiently numerous in terms of people and institutions to actually provide the regulations. And the political actors are going to be constantly struggling between multiple pressures in relation to government, in relation to business and the constant spectre of job losses and small and medium enterprises going bankrupt. So our emphasis in these regular briefings and in all that we do through our webinars and other activities is going to be on encouraging the kind of work I described from the Australian meat factory, encouraging people to work it through for themselves using the kind of strategic principles we offer, finding the middle path, and that we hope will be helpful. Just as we sign off, Marianne has said, is there any improvement in the global response from the UN General Assembly? Yes and no, Marianne. I just can't tell you that it's all come good, but I'm sensing on a number of issues, vaccines and regional cooperation, a real shift. And the absolute excitement is that African countries do seem to be much more together than anybody else. Here now we go to Chris. Here is Chris's screen. Chris, if you'd like to let off, you could talk, and then we go to Twee for the survey result, and then we will close. Chris, please.
I have to go to do the school run in my mask, you'll be glad to know.
Very good.
Thank you. It's been great to hear this one.
Two things on this, because you've done some super illustrations here. Just pick out a couple of things before you go that you want to draw our attention to.
Well, I mean, it's interesting because in our household, my wife does all the worrying about the virus and I do all the worrying about the economy. Yeah. So, I'm throughout all of this has been thinking about that because I've had to effectively start my business all over again. And I do go around saying to people, we can do both.
Yeah.
And I'm very interested in expanding on that and hearing more about that in the future.
So Chris,
the sweet analogy was great. So
okay, so I want to tell everybody, from my point of view, Chris's scales with it's not a case of saving the economy or fighting the virus. I think that's a beautiful thing. The virus only wants to reproduce. It's rather beautifully put there on the top left. And thank you again for the sweet bag. Everybody, a big, big, big shout out to and thank you to all the illustrators. And it's so kind that they give us these remarkable visual narratives. Thank you to Twee to finish us.
Thank you, David. So good to see some, at least one person from East Asia and Pacific region, mostly coming from Europe. Age range, mostly coming from 41 to 50 years today. And then how we're feeling. Again, optimism, hopefulness, the most common. And again, I'll say, let's keep that conversation going. We are seeing some good conversations come through on that LinkedIn community chat. So I'll see you there or next week on Tuesday.
Thank you. Thank you, Twee. Now, yes, we've been quite focused on the UK. We've been blessed because we had Mike Sanders here to help us. But also, in a way, the UK has, over the last few days, been quite interesting as a case study. But I want to thank all of you from all over the world who've joined us, and particularly those of you who I know are struggling quite hard at this time, and who are keeping the dialogue going in the WhatsApp group and all the rest. I'd just like to give special greetings to Polly, who I hope is here, and because I see Kristen Fawcett, and if Polly is here, we might be able to see Isaac. It's a special treat. Hello, Isaac. And I suspect Otto is not there, otherwise we'd see him as well. He's asleep. Polly, thank you for joining us. And Polly's mum is also here, Susanna. Lovely to see you. Been focusing a lot on the north of the UK today. Everybody, you know, I'm just thinking of all the people I'd love to come and give a big hug to, but can't. Chris Langdon, I didn't mention you at the beginning. Thank you. Anne van Bolhuis, thank you for being here. Lovely, lovely that you're joining us. Again, Haruko, thank you for staying right through the whole briefing, even though it must be, I don't know what time where you are in Tokyo, but it's lovely that you were here. Vicky, thanks for giving us your observations and for all the work Nazim is doing. Please send our best wishes to everybody at Liverpool School of Tropical Medicine. Holly, thank you for a wonderful time. You look like you're in the car. You must be doing something like that. But thank you, Holly, for the chance to be on the NHS leadership group with you and John and meet up with, including a load of absolutely brilliant people. And perhaps my sign-off remark is, you know, the public health community, people like Mike, we really depend on them right now. They've got, and they have been working flat out since the period really mid-February when this started to pick up. And we've got to find some way to give them extra strength, where we'll send them all our best vibes because they're going to get no respite for the next few months. And you could hear from Mike that also there's satisfaction in that work. If they can get it right with the local action and find the clusters and know where the virus is, they can really, really make a difference. Congratulations to the Leicestershire team for what you've been able to do. And with that, I say bye-bye. It's lovely to be connected. We'll be back again next Tuesday. À la prochaine, as they say around here. Yeah, merci.